Hello, I'm speaking today from the SOHO Italy 2023 meeting. This meeting is in collaboration with the SOHO Houston meeting. It is one of the larger SOHO meetings and is providing a great forum for collaboration, especially for junior faculty and fellows to interact with experts from around the world, including the US, Germany, Italy. So far, the meeting has been going fantastic. We've had a number of great presentations. First day was acute lymphoblastic leukemia, now acute myeloid leukemia. I'm very, very impressed by the organization. We've been working very closely, Dr. Jabour, myself, with Dr. Martinelli and Sercioni, along with the whole MD Anderson team and led by Dr. Kantarjan. We're seeing a very, very good turnout. So I hope this meeting will continue to grow and expand even beyond Italy in the future. The discussion topic that I presented was immune-based therapies in the treatment of acute myeloid leukemia. This was in the AML clinical session. My focus in clinical research at this time is the development of novel immunotherapies for the treatment of acute myeloid leukemia. These include cellular therapies as well as immune checkpoints such as CD47, TIM3. What we're seeing in the field of acute myeloid leukemia is that there is a development of immunotherapy, and allogeneic transplant, which is an immune modality, has been the cornerstone of treatment for the last 40-45 years. However, we have struggled to move beyond the allogeneic transplant to other immune checkpoint-based treatments. The PD-1, PD-L1, CTLA-4 inhibitors unfortunately did not show the activity we were hoping, and we are no longer focusing on the development of these agents. We still are looking at other innate immune checkpoints like CD47 antibodies, although some of the data from the MDS study showed that there was no clear improvement. We're still waiting to see the AML data. But I really think for the future, 5, 6, 7 years from now, the focus is heavily moving towards cellular therapies, and these include both autologous CAR T cells as well as allogeneic CAR T cell therapies with numerous different targets. We're especially excited about CLL1, CD123, and there's a number of different constructs currently in clinical trials. At MD Anderson, we actually have 6 different CAR T NK cell studies in AML. Just 3 years ago, we had none. So this shows the enthusiasm and excitement both from sponsors as well as academic institutions to move forward. We're also doing a number of different modifications to the CAR T construct. These include CRISPR-based changes such as knocking out TCR, knocking out beta-2 microglobulin, improving the lymphodepletion with the incorporation of higher dose Cytoxan, as well as potentially using alemtuzumab in the setting of a CD52 knockout CAR T, as well as most importantly looking at bispecific or trispecific CAR Ts and NK engager. And I think most importantly focusing on low burden disease. I think this is the single most important thing as we develop treatments in AML, cellular therapies, is to put them in the place where they're most likely to have success so we don't have early false negative and abort the development. I think MRD, low burden disease, is the right place for these. So a lot of this is coming together. We're starting to see presentations at ASH 2022 with clinical data and responses from the CAR T, and I think we will see more and more in this in the future. And I think this could become, like ALL and myeloma, a very effective MRD eradication strategy. Maybe not yet, but in the future could potentially even become a replacement, we hope, and are trying to find out, for allogenic stem cell transplant. So thank you again for listening. Hope you can attend in person the next SOHO Italy. And thank you all for the organization of this fantastic meeting.